Our presentation is over new graduate nurse residency programs and if they prepare the new grad nurse for the realities of practice. The learning objectives for this presentation are to understand what new graduate nurse residencies are, understand the challenges the new grad nurse may face when transitioning from their education to the professional practice, evaluate current policies in place to help new graduate nurses, and understand the cultural implications related to new grad nurse residency programs. Many new nurses feel very overwhelmed once they graduate and begin their first job as a nurse. This stress is highly associated with overwhelming clinical practice, lack of workplace support, and a knowledge deficit. Many new graduate nurses reported that compared to their actual practice, their education was far too idealistic, and they were not prepared for unfamiliar situations. This not only puts their patient at risk, but it also increases the new grad nurse's anxiety and fear to go into work. This directly resulted in higher number of patient bad outcomes and higher call-ins to work, which would leave the hospitals further understaffed. When there is a smoother transition into practice, these stressors can work to be decreased and eliminated. This not only improves the environment for the nurse to learn and work in, but helps to ensure safe care for the patients. New graduate nurse residency programs aim to better prepare new nurses for individual practice by pairing them with an experienced preceptor for their orientation to their position. In order to promote the safety of patients and well-being of the new nurse, standardized programs are necessary. They can help to decrease the reality shock of nursing by providing support, a manageable workload, and appropriate patients for the nurse's knowledge and experience level. This ensures that the nurse can continue to learn without overwhelming them and compromising their patient safety. The new graduate nurses are paired with an experienced preceptor and get to phase into adding on patients. They also get to ask questions and have somebody with them when they are first starting out and move into their individual practice at their own pace. Why are new graduate nurse residency programs important? The percentage of nurses that intended to leave healthcare and change careers surged, especially during the COVID-19 pandemic. This was due to new nurses being overwhelmed after being expected to care for high acuity patients without proper training. New graduate nurses in particular are at a much higher risk of experiencing the effects of burnout, emotional exhaustion, and having a high level of stress. This is primarily due to the lack of experience and preparation for the intensity of their role in the care of patients. Up to 30% of nurses leave their profession within the first year of nursing, which is significantly higher than the percentage of experienced nurses leaving the profession. Lack of support that can come from being thrown into a unit without a residency program significantly impacts the work of a new grad nurse. Studies have found that new nurses have felt very unwelcome and developed unhealthy relationship with their colleagues. Not only has this led to lack of support and lack of help when caring for their patients, nurses feel like they are left drowning and dread coming to work. Additionally, new grad nurses have reported that they've experienced the concept of eat their young, in which new nurses are treated poorly and receive no help from senior nurses for their own good, and because that's how they learned when they first started. This increased new nurses' fear of coming to work and decreased their likelihood to ask for help when needed. While new grad residency programs may not completely eliminate this issue, it can pair a new nurse with someone who values the new grad nurse's education and helps them have an easier transition into practice.
In an article about providing organizational value to improve nursing turnover, it starts off by saying new to practice nurses are leaving the nursing profession at a nearly 17% rate within their first year and up to 30% rate within their first 3 years. It is reasonable to assume that as new practice registered nurses, it can become overwhelming when working in a negative work environment that is already overstressed, and self-doubt and ineffective resiliency skills may lead them to conclude that they have entered the wrong profession altogether. In the same article, the cost to replace a bedside nurse is $52,000. This highlights the fact that the cost in both real dollars and physical and emotional toll on the nurse and the organization, considering the cost of financial implications of the turnover, has been identified that new graduate nurses have a higher turnover cost than experienced nurses. due to the amount of dedicated training hours, the need of experienced educators, and competent preceptors in a new grad nurse residency program. There are currently 2 accrediting organizations, the ANCC, which accredits RN residencies, RN fellowships, and advanced practice registered nurses, such as APRN fellowships, and the Commission of Collegiate Nursing Education, the CCNE, which accredits post-baccalaureate nurse residencies. Both programs recommend that a nurse residency program run for a minimum of 6 months and develop individualized curriculum to progressively build the skill and knowledge, which are core competencies based on management and delivery of high-quality patient care and the development in their own professional roles as nurses. In another study conducted by Fala in 2021, which was a longitudinal perspective study. A longitudinal perspective study is a type of research that follows a group of individuals over an extended period of time to observe outcomes or changes. The longitudinal aspect refers to studying the same group of people over a longer period of time. It tracks changes and developments over time. A perspective study in this context means that researchers start by identifying a group of participants and then follow them into the future to observe how things unfold, as opposed to looking backward, which would be a retrospective study. This study demonstrated that 117 new graduates who completed nurse residency programs had a retention rate of 85% at 12 months. In addition, they reported that since the inception of the nurse residency program, the 1-year retention rate is greater than 96%. These studies concluded that residency programs and resources can be used by nurse leaders to enable newly hired graduate nurses by feeling empowered and engaged in their organization, and may guarantee that the development of professional nurses who are actively immersed, competent, and clinically proficient. The ANCC Practice Transitional Conceptual Framework is based on Patricia Benner's Novice to Expert Framework. It focuses on helping new nurses transition from students to competent professionals. Benner's framework outlines 5 stages of the nursing development. 1. Novice, new and inexperienced. 2. Advanced beginner, some experience but still needs guidance. 3. Competent, able to manage multiple patients, more independent. 4. Proficient, sees the bigger picture, makes decisions intuitively. 5. Expert, highly skilled, makes quick expert decisions. The ANCC framework applies these stages to help new nurses grow through structured transition programs, support, mentorship, and ultimately help them become confident and competent nurses and expert nurses. This model helps relate everything back to retaining nurses on the previous slide, making sure that each nurse is prepared and reaches that expert level to provide competent care.
I'm going to talk about some policies that exist for new graduate nurse residency programs. First, I'm going to talk about accredited programs. So there are currently 2 organizations that accredit nurse residency programs. One of them is the American Nurses Credentialing Center, or the AACN. The second is the Commission on Collegiate Nursing Education, or the CCNE. The role of these accrediting organizations is to set the regulations and requirements for nurse residency programs. So basically, they're responsible for deciding how their nurse residency programs are going to be run. Some of the things they do are establishing the length of their programs. Both organizations have a recommended length of at least 6 months. They also outline the curriculum for these programs to follow, and these organizations are also responsible for evaluating the outcomes of the program and determining the effectiveness. So now I'm just going to talk about some of the overall policies and what we're actually seeing in practice. Policies for graduate nurse programs still have a lot of challenges. For one, there really aren't many policies in general. Overall, the policies that establish the regulations and requirements for graduate nurse residency programs have only recently started to develop. About half of hospitals in the United States offer nurse residency programs to begin with. And as of 2022, only 40 nurse residency programs were accredited by the CCNE, and in 2021, there were about 600 hospitals offering programs that were ran by the AACN. And what this means is that a majority of graduate nurse residency programs aren't being overseen by an accrediting organization. And most often, this means that the individual facility is responsible for establishing their own policies, and there's really hardly any standardization on a national level. This lack of standardization can be a good thing. For example, this gives more individuality and autonomy to the hospitals themselves to set their own policies for their programs. So these programs can be more geared towards the specific needs of the nurses at that hospital. But there are also problems that come with this. A lot of these programs can vary greatly from one to the next because they're not standardized. This makes it much harder for reporting and evaluating the outcomes of each program, and this is a necessary part in improving and advancing graduate nurse residencies. On the other hand, there are a lot of benefits that come with a more standardized and organized graduate nurse residency program that would come from an accredited organization, being involved in the program. Some of these benefits include things like increased job satisfaction, increased retention, and reduced stress for these nurses. So, from what we've seen from this research, the effects of having an accredited program can really help new nurses with some of the problems that we see just overall in the nursing career. Some other benefits that are seen include increased competency and a reduction in error. So basically, having an accredited program benefits nurses, patients, and the hospitals as a whole. So finally, there really aren't a lot of nurse residency programs available that are accredited, but having this more standardized nurse residency program has been shown to have a lot of benefits. They directly benefit the new nurses, and these effects can also improve patient care, and they can also be beneficial for the hospitals themselves for reasons like improving retention. And from a more overall perspective, having a standardized program for graduate nurse residencies really opens the door for tracking how effective these programs are, and it also makes it easier to identify ways we can continue to improve this transition for new nurses. So, for our recommendation for the policies for new graduate nurse residencies is just pretty much to expand these nurse residency programs and making this more of an attainable option for new graduate nurses.
So now I'm going to talk about a little bit about the cultural implications related to the transition of new grad RNs into professional practice. So culture is something to consider when thinking about new graduate nurses and their transition into professional practice. We all know about the term culture shock, and this is something that new grads significantly face. This can be from many factors, such as the way a hospital operates, the reality of having responsibility of real patients, time management, graduating school with knowledge gaps, how experienced nurses treat new nurses, and many other things. On this slide, I will help explore some of these cultural differences in greater depth, and I will also explain how residency programs help overcome this. To help further analyze and explain this, I used the article called First Years of Experience, a Mixed Method Study Exploring the Work Environment and Transition to Practice of Graduate Nurses. The researchers in this article surveyed a total of 405 nurses graduating from BSN programs with at least 3 months of experience. One of the cultural challenges that came as a shock to nurses when they started working was that they were no longer practicing in a contained environment where they were under constant supervision and monitoring. They were no longer dealing with simulations or other nurses' patients, but they were in charge of real humans in environments where many things can go wrong. They felt overwhelmed by the sudden responsibility of having complete autonomy over their patients and knowing that every decision made was up to them and not under guidance. Another cultural shock for them was the theory practice gap between the classroom and real life. According to this article, this is the highest reported challenge that new nurses face. The knowledge that is provided in school is not always applicable to real life situations because there are external factors that affect practice in the real world. A final highly reported issue, cultural stress, is the lack of support. New grads are thrown into an environment where everyone is busy looking after their own patients and don't have much time to slow down and help others. 54.8% of nurses reported this to be a challenge and said that they desired more help from floor managers and also mentors as they began working. An article called Student to Nurse Transition in Nurse Residency Program, a qualitative study of new grad preceptors or perceptions, provides evidence showing how the nurse residency program helps combat the cultural challenges new grads face. One fear mentioned about new grads is lack of supervision, but nurse residency programs provide a whole nother learning environment in the real world. Throughout nurse residency programs, there are more simulations, practice scenarios, educational sessions, and other things, which help provide continual learning and monitoring in the learning process. A nurse residency program student stated, having a full program backing you up to smoothly enroll into the system of the hospital is really helpful. You get to learn a lot from experienced nurses who went through a lot of challenges and get to update your information and skills. It relieves all your worries and stress about your competence. The nurse residency program also supports the theory gap practice through this. It provides a lot of classroom time that allows nurses to dive deeper into the material than they were able to in school. According to studies, 47.9% of new residents say this was the biggest benefit of a new grad program. Finally, it provides mentorship. In the prior article, it talked about how preceptorship can be a key component of new grad programs. This helps combat the cultural struggle because the new grads feel like they're not alone. They get to have an experienced preceptor right by their side for at least 3 months, and they can use them as their biggest resource for all questions and concerns. One student stated, "My preceptor was very knowledgeable, committed, and patient to me. She was supportive, she taught me everything, and she prepared papers for me at the beginning of my internship. I sometimes make mistakes, but we learn together." These journals show that although there are many cultural considerations that can make this transition difficult, the nurse residency program is the best way to combat it. And thank you for listening. Here are some of our references, and have a great